They told you artificial intelligence was going to fix healthcare. Cheaper drugs, faster diagnoses, a doctor in your pocket, personalized medicine for everyone. A utopia where technology finally cracks the code on human suffering and makes the whole broken system work for you for once. And you believed it, because why wouldn't you? The TED Talks were very convincing, and the stock prices were going up, and everyone on LinkedIn was posting about disruption. But here's what actually happened. The average American health insurance premium just hit a record high. 1 in 4 adults is skipping medication because they can't afford it. Hospitals are still the #1 cause of personal bankruptcy in this country. And the artificial intelligence your doctor's office is running, it was never built for your health. It was built for their revenue. Welcome to artificial intelligence in healthcare, where Silicon Valley promised to cure cancer and instead perfected the art of denying your claim faster than any human ever could. Let's start with the most unhinged part, and no cap, it only gets worse from here. You've heard of prior authorization, that soul-crushing process where your insurance company has to approve your treatment before your doctor can actually treat you. It used to take a human reviewer about 2 days to read your case, look at your history, and make a call. Now, United Health and Cigna have replaced that human with an algorithm called NH Predict, and it makes that same call in 1.2 seconds. Sounds efficient, right? Sounds like progress. Here's the stat that should make you put your phone down. United Health's artificial intelligence denied post-acute care claims at a 90.4% error rate, according to a 2023 Senate investigation. 90.4%. That means the algorithm was wrong essentially every single time, and it was still making the calls, still denying the treatments, or still sending people home from rehab early because a model trained on billing codes, not your body, not your condition, not your doctor's judgment, decided you were fine. So your doctor approves your surgery. The artificial intelligence says no. You appeal. That takes weeks. Your condition gets worse. Your bill doubles. And United Health posts another record quarter. They built a robot that's wrong 9 out of 10 times and made it the gatekeeper to your spine surgery. But if you think the denial machine is bad, wait until you hear how they priced you out before you even filed a claim. Companies like Anthem and Humana are feeding your data into predictive health risk scoring algorithms. Models that look at your zip code, your grocery purchases, your social media activity, your neighborhood's median income, and use all of it to predict how expensive you're going to be as a patient. Then they price your premium accordingly. A 2021 Health Affairs study found that people in low-income zip codes are assigned risk scores 23% higher than people with identical medical histories who just happen to live somewhere wealthier. You have never been hospitalized. You go to the gym. You eat well. But you live in the wrong neighborhood, and the algorithm has already decided you're a liability. Congratulations. Your premium just went up. Your fitness app data isn't making you healthier. It's making your insurance more expensive. Then there's the part where the bill itself becomes a weapon. Hospitals now use artificial intelligence from companies like Optum and Nuance, which is owned by Microsoft, to auto-generate billing codes directly from your doctor's notes. The system scans the language, identifies every possible diagnosis mentioned, and then selects the billing codes that maximize reimbursement. It's called upcoding, and it is absolutely unhinged in scale. The HHS Office of Inspector General estimated that artificial intelligence-assisted upcoding added $140 billion in excess Medicare charges between 2018 and 2021 alone. $140 billion. That routine checkup where your doctor mentioned you seemed a little stressed and your cholesterol was borderline. Like the artificial intelligence coded it as a complex chronic condition management session, your deductible evaporated. The artificial intelligence didn't misunderstand your appointment. It just knew which misunderstanding made more money. It gets worse when you are actually sick and trying to figure out what's wrong. POV, it's 2 a.m, you have chest pain, and the healthcare system has replaced the nurse hotline with Ada Health, Babylon, or Amazon Clinic. A large language model trained on medical literature that will give you a differential diagnosis with zero medical license, zero liability, and zero consequences for being catastrophically wrong. A 2023 JAMA study found that artificial intelligence symptom checkers gave the correct triage recommendation only 54% of the time for urgent conditions. That is barely better than flipping a coin. You type in chest pain. The chatbot says likely anxiety. Try some breathing exercises. You stay home. It was a clock. They replaced your access to a trained medical professional with a chatbot that is statistically comparable to guessing, and they called it democratizing healthcare. I'm not being dramatic. The math is just mathing. And if you think the diagnostic tools your actual doctor uses are more reliable, buckle up, because this one is genuinely Black Mirror level. Artificial intelligence diagnostic imaging tools. FDA cleared products like IDXDR and VIS. Artificial intelligence, are being deployed in hospitals across the country to read your scans, flag your conditions, and help doctors decide your treatment path. The problem is that these models were trained predominantly on data from white male patients, because that's the demographic that dominated clinical datasets for decades. A landmark study published in Science by researcher Ziad Obermeyer found that widely used health artificial intelligence systematically underestimated illness severity in Black patients by 26%, which directly cut their access to specialist care. But the model wasn't being malicious. It was being accurate for the population it was trained on and inaccurate for everyone else. And nobody checked before they deployed it on 200 million patients. It's not a bug. The dataset was the bias, and the bias is now embedded in the infrastructure of American medicine. But at least your sensitive health data is safe while all of this is happening, right? Hard no. Hospitals sell patient records to artificial intelligence companies under the legal fiction of de-identification. The idea that if they strip your name off the file, it's no longer your data. Research has shown that de-identified health records can be re-identified with 87% accuracy using auxiliary data like age, location, and diagnosis combinations. And then in 2024, Change Healthcare, the artificial intelligence-powered billing clearinghouse owned by United Health Group, the same company from Block 1, suffered the largest healthcare data breach in American history, exposing 190 million patient records in a single incident. 1. Company, 190 million people. Your mental health diagnosis, your abortion, your HIV status, your substance use history, all of it, sold to data brokers and leaked to hackers, and now permanently attached to a profile somewhere with enough data points to identify you specifically. They said your data was anonymous. They lied, and they charged the company that bought it less than the cost of your copay. And just when you think maybe the administrative artificial intelligence is at least making your doctor's life easier so they can focus on you, here comes the final hit. Tools like Suki Artificial Intelligence, Abridge, and Epic's ambient documentation systems use artificial intelligence to listen to your appointment in real time and auto-generate clinical notes, eliminating the administrative burden that was eating up physician time. Sounds great. The catch is that hospitals didn't use that freed up time to give you a longer appointment. They used it to justify booking more patients per day and pocketing the margin. Average physician appointment time dropped to just 15.7 minutes in 2024, down 18% from 2010. Exactly the period during which artificial intelligence administrative tools proliferated across hospital systems, or according to the Merritt Hawkins report. The artificial intelligence saved your doctor 8 minutes of paperwork. Your appointment still got shorter. You still left without half your questions answered. Efficiency in healthcare doesn't mean you get more. It means they extract more from you in less time, Sana. So here's the damage report. Artificial intelligence in healthcare was never designed to make you healthier. It was designed to make the system faster at charging you, denying you, surveilling you, and profiting from you. With a layer of algorithmic plausible deniability so thick that no regulator can pierce it and no lawyer can sue it. The algorithm made the call. The algorithm doesn't have a medical license. Nobody is responsible. You're just a data point that didn't convert. Before your next appointment, check if your insurer uses automated prior authorization. Before you trust a symptom checker, remember it has a 54% accuracy rate for urgent conditions. That's the bar they set and celebrated. Before you sign any patient data consent form, you understand that de-identified is a legal fiction that a college student with a laptop can undo in an afternoon. The infrastructure being built right now around your body and your health decisions is not neutral, it is not benevolent, and it is not fixable with a better app. Like this video if you want to survive the algorithm,